I know sometimes there's audio as we're going live on multiple platforms today, and I have a message that I want to share. So, this is very important, dentists out there. If you're seeing this video, or if you know someone that's a dentist, work at a dental office, goodness, we all have mouths, right? So, this is a very important topic, and if you just have a few minutes, I think you'll find it very helpful. But this video and this particular topic is going to be more geared towards the dentist. I'll be doing another video that we talk to the patients, but we all know that the mouth is part of the body, right? And I think we'll all agree that health starts from the mouth. But this will be one of the most important presentations for 99% of dentists out there, because it wasn't until I lost my dad far too early at the age of 62, and especially in a time like today where there's advanced medicine and all of these treatments. But my big question to you is with all of these advancements and treatments, are we actually doing a better job, or have we missed, the most important thing that's, and not, no pun intended, but right underneath our nose, right? And so for all of the doctors out there, because you are a doctor of the mouth first, again, if you are watching this presentation and you know a dentist or you have one in mind, please send them this video. This is going to massively help them. And my hope is that if they watch this video, that they will say thank you for changing their life and their practice. Because what you may not know, and for the doctors on this call, is most of the dentists I meet are not doing Medicare and not doing medical billing. And it's not good. It's not good for you, it's not good for your practice, it's not good for your patients, your team, the healthcare system, and everybody. And let me explain why. Because doctors are, or dentists are, doctors of the mouth. And without dentists doing their job and at full capacity, we really don't have a healthcare system at all. We saw this when all of the dentists were asked to shut down. All of our dentists didn't shut down. There was a difference, because our doctors, our dentists, received a check from the federal government asking them to stay open as an essential healthcare provider. Meanwhile, all of ADA asked their dentists to shut down. And so I'm saying this just to lead into, I have a couple of things that you can see behind me on this presentation, and I'm going to go through them one by one. But this is just a quick video to share what I think we kind of already all know, but I want to address this because it's very important. 99% of dentists that I meet are delaying dental treatment that a patient needs, or turning away patients that have the money to pay them, but because it's not in a form that they recognize, Medicare or medical insurance, they just don't know how to take it, they're turning them away. So I hope that's not you. And if you are watching this video and a dentist, please take the time to save this, or come back to it later, because as long as I don't mess up on this video, I only plan on doing this video once, and I'll be making a lot of other videos on other topics, but this one will be very important. So dentists, you all know that you are doctors of the mouth, right? You're a person qualified to treat the diseases and conditions that affect the teeth and gums. And the problem with that is everybody knows the definition, but the problem is when I ask you, or when I ask any dentist out there, so then what are the ADA codes that you use to get paid for the first line, right? The most important and the most valuable part of your work. Because everybody in the dental office, and in most cases, they focus on the teeth, and we're all good at that, right? We have prices for crowns, we have prices for extractions, but when it comes to the most important and valuable part, the doctor portion of the work that you do, right? Living patients, not cadavers anymore. There's a disconnect, because the dental school was really great at the dentistry, but either we assumed or we forgot to, as we went into practice, do the second part of opening the practice, which is dental school only teaches you the clinical bit. There might be a little bit of business depending on the school, but the business is the most important part, the admin, and how you really interface or communicate with your patients, right? So dentists are doctors of the mouth. Remember, you are a doctor of the mouth. In most other countries, by the way, dental is a medical specialty, and there's no confusion about this at all. So that's what we're trying to do, or I should say, that's what we're in the process of doing. And it's nothing other than just education and knowing that it's possible. You don't know what you don't know, and I'm sure there's other videos or things that you could see on that, but that's what this is about. It's just to shine light on things that you may already know or you may not have thought of in this particular way. So dental, I know that, speaking of dentists, this is kind of preaching to the choir here, but it's not the word dental I'm trying to explain. It's that this word was never intended to be a reason or excuse to deny or not cover or to not treat the mouth, right? And that does need to be said, because we all are experts at dental, especially as dentists, but most dental office managers that I meet and dentists are okay with not accepting the most important part and valuable part of their pay because of some dental insurance or some medical insurance policy. It doesn't matter. I'm of the belief that all dentists, and especially doctors of the mouth, should have a fee schedule and should have a menu, and it should be clear. I can't believe how many dental websites that I go to and it's just not there. The information that you need, or I need as a patient to go there, it's like going to a restaurant and you have to guess at what the menu is. And once you actually have the menu figured out, you have to go through different pages to even know what is the full things that they offer and what is that price. It's very vague and it's very confusing. So I don't mean to digress, but okay, so the mouth is part of the body, and we all know that you can't have a healthy mouth or a healthy body without a healthy mouth, right? I mean, health is from head to toe, and we all have this thing, either employee sponsored or government, sponsored, but we all have this card, or we should, right, that covers us from our head to toe. And that is the priority. Even as a dentist, I know we focus so much on teeth, but I say that specialization is great in research. It's great for education, and goodness, it's great for school. Like, we need to, like, if we learn math, science, reading, and all of that together, it'd be very confusing. So there's a reason why we learn things in isolation. But in practice, if we try to just do math and, like, for example, we just forgot all of the math that we knew, but we tried to have a speech, you wouldn't be very effective communicating anything to have to do with numbers or engineering, computer, anything, right? So we have to realize that the things that we learn to get us our degree or for us to open up a dental practice are very different than the things that we have to do to actually be a dentist and actually operate a dental practice, right? So we'll get into the next point here is that medical, it's literally, right? I mean, I say this here, that dental is medical. And some people are confused by that, because if I ask 10 different dentists in the room what dental is all about, what is dentistry, they're very much confused. And the sad thing I have to say is I see too many dentists saying of themselves that I'm just a dentist or I'm just a tooth doctor. And maybe, as they say, the biggest enemy that you have, or you are your own worst enemy, or that the biggest problem that you may have is, the thinking that you choose to do or you choose to identify yourself with. So I know that's a lot easier said than understood and actually absorbed and then done, because we all have, egos and lives, and I get it. But okay, to get back to this medical, I really like this presentation style, by the way. So let me know, by the way, if this is working for you, if this is helping for you. This is the first time I've done it in this format, but it's keeping me on track. And I hope that as I explain this, this is making sense. Because this is probably the most important message, that if I had a billboard, we're going to get billboards, but we're not going to put this on it. But if I had a billboard for dentists, like if I knew that there was only dentists that were going to read it, this would probably be what's on the billboard, but not where people are driving, because I don't want them to I want them to focus on driving, not reading this. Anyway, so medical, you gotta have fun, right? This is what I've been thinking about for the last 4 or 5 years, so I do digress a little bit. But medical, this one presentation I'm doing is, if you just understand this one point, I think that you can literally double or triple your practice in dentistry by the end of this video, really, if you just apply what I'm going to talk about here. So what more important part of your body is there than your mouth? That's a question I have, for any of you out there, because and as a dentist too, I mean, I know you do the work probably every day, and you may not think about it, but if someone had asked you, and for anybody watching this video, would you accept $1 million to take out all your teeth? And we've asked this in events and in front of audience and people, and you'd be surprised. $1 million is a lot of money, or at least it used to be a lot of money. Some would disagree, but point is not a single person raised their hand. I mean, even raising the amount, even we did 5 million, 10 million, nobody raised their hands. I think there was maybe 1 or 2 hands raised at like 5 or 10, but they had already been missing most of their teeth anyway. So for them, they wanted the money to pay for their dental, right? But I ask that because we don't think about that. We focus so much on our problems and the issues that we're thinking about, right? Or our life, but there really is no more important part of the body than our mouth. It's literally where we eat, we breathe, we chew, right? And again, I don't need to preach to the choir, but so that's why I say that dental is medical. Let's choose the best dental health. And I know that you kind of already do as a dentist, but let's make sure that we see our profession and what we do here in dentistry as not just a dentist, but a doctor of the mouth. And it's the number one most important job, I think, we have as a society, and as being part of this healthcare system. So it should be something that you do, and I'm telling all the patients we should demand from our doctor, and not just from our dentist, but from all of our doctors, all of our healthcare, to get the mouth checked out. Just because you're in a hospital and they don't have a dentist and they may have an ENT, it's not a good enough reason to not fix the problems or the issues in your body in the order that they occur. I mean, if you could, and you found out, we now know this is common knowledge, but 70% of all heart disease and breast cancer starts from the mouth. We know this from evidence, and now we're finding out that all disease starts from the mouth. And at first, that may sound like an alarming statement. It may sound like a surprise. Some of you may already know. But if that's the case, everything that we do in healthcare in the United States flies in the face of what we know. And that is a problem, right? This whole excluding dental or segregating dental from medical, or the teeth and the mouth from our body, is a mistake. I mean, it was done for political and financial reasons. I mean, I think most of us, if not all of us, know that. But we never did anything to restore it. So I'm going to be that champion for you, dentist, and for the industry, and make sure that this is fixed and this is solved. We've already done it in one state. There's already one state now that is covering dental in 3 different categories, or at least they've promised to, and they're still in the process of rolling that out. But it gets to the next point, that you are doctors, right? Hospitals know that they need you many times, that they even have a dentist that they call on staff because they need the mouth to be cleared for certain surgeries. It makes no sense for a hospital to do heart surgery or breast cancer, chemo, when we now know that in 70% of the cases, and a lot of the research is saying it's a lot higher than that, but if they just get rid of or clear the mouth issues, that most of the other issues either alleviate or go away entirely. So that's why dentistry is very important. And I forget who said this, but it is true that what is an elective today, if ignored, becomes an emergency tomorrow. So let's just all, be smart about this, or work together and collaborate, because dentists are doctors. They're the most important part of our healthcare system. And if we did this right, dentists, doctors, you would all get paid. So right now, 1%, the statistic is only 1% of you dentists are getting paid the money that you should have always gotten paid, but didn't, because you or somebody on your admin team just didn't, poke you and say, hey, you know, you're you're not doing cadaver work on pig brains or pig heads. You're working on living patients now. Forget about the dental, right? I mean, that's how you learn school. That's your license, but you're working on living patients. So let's talk about being aware of what field you're even on first. If you think that you're just a dentist and just doing dental, you're playing really small. And it's a choice, right? There's other dentists out there, the dentists that we work with, clients of ours, and as you can see, we're going to be really raising a whole industry there because my goal is to collaborate dental and medical because I believe that health starts from the mouth, or rather I know it does. And mouth is part of the body. And I believe that the solution to this whole healthcare system is just making sure you as a dentist get paid what you deserve because you are the number one doctor and the only doctor that can affect the most important part of the body and the only part of your health that when affected by a doctor, when treated by a doctor, can actually really affect the other areas of the body. Okay, and we'll get into that in some of the other videos here, but I'm just so proud of my dentists that are going out there and treating and helping patients because we're finding out again, like if you do heart surgery or chemo, you're mostly doing treatment that is either wasted money for you, the healthcare system, the only people making money are the people selling the machines and the chemicals, but it's not the patient that's benefiting. And in most cases, the doctor isn't even, because some of these guys are getting large malpractice suits that are coming down on them. Now, it's not compared to dental. Dental has huge malpractice and it's only getting worse because, and this is the answer to it, by the way. I'm not going to just detail it all on this video, but this is the answer. This is the answer to many of the healthcare problems, but also to the high medical malpractice, which 13.1% of it is all in dental, right? Out of 200 medical specialties, if dental has 13.1% of all of the medical malpractice, to me, there's definitely something that's a problem there. I mean, yes, everybody has dental issues or dental needs and so sees a dentist, or actually not everybody. Only 30 or 40% do, and that's a huge problem. So I don't mean to digress, but a quick side note, we are going to work to move that number up. But to get back on track, that's what we're talking about here, folks, is we're talking about collaborating the system. And a critical part of that is I want to make sure that the dentist, you watching this video, get paid for the doctor portion of their work. This helps the patient, so that way they don't have to pay for treatment out of pocket, or dentists all around town and all around the nation aren't asking them for their dental insurance or their money out of their pocket. It shouldn't be that way. When you go to a hospital, they just treat you first. They take care of you, right? They treat you like a human being that needs help with your health. In a dental office, it's not that way. And I get it, like it's a private practice and we all have to make money. So you want to make sure that they're financially qualified and can choose the treatment options within their means. But what I'm trying to say is there is a smarter way. And if we did get paid fully, I mean, we're talking at least 50%, but some doctors I know are recouping up to 60 or 70% of the revenue that they always should have had, but just didn't. And so there's one last thing that I will say is that patients can actually bill and they can receive a check by themselves. And we're teaching patients how to do that as well. So they can bill themselves and they can come to you with a check. They're educated. We do patient advocacy. And this way they're ready. They're educated and they know exactly what they need and what they want before coming to you. So that's what we're doing too. That's not really for dentists, but dentists have teeth too, right? And if you ever find yourself in that patient situation, you can bill for yourself, right? So there's actually a lot of dentists out there that are in that Medicare category now. So anyone that's 65 and older, but keep in mind it's not just for 65 and older. It can be anybody with a chronic condition, illness, or disease. So that's what it's all about. Now, for anybody that is out there watching this video, if you're a dentist, if you're a doctor of the mouth, I have put together a cheat sheet of codes, and we've used this, and we've never shared this before. We've charged a lot of money to other doctors for this. Now, what I'm going to do is for the people that want to get started, and this is just 100% free, I have an offer here for you that you can go and download these cheat sheets. It's a free download that you can get, and it will share all of the 141 most profitable dentistry codes right now in 2023 that you could and should be using to get paid fully for the doctor portion of the work that you've probably always done in your practice but just didn't get paid for. So you can do that right now by going to dentalismedical.com. It's 100% free, but don't leave yet. Before you do that, take a screenshot. You can scan this QR code or however it is that you want to do that. But I do have a very important offer that I want to talk about because today it's going to be launching, and you'll probably hear more about this in the future. But for now, while you're here, we've separated this and made it easier than ever before. We've worked on this software for the last 4 years, and we've had over $22 million, as I've said. We've helped over a couple hundred dentists, and that's all we do is dental. And over about 5,000 patients now to count specifically. So our goal is to get every single dentist on board or at least aware of our program, and to be able to make this accessible. What we did is we made our easy eligibility program, and it's going to be available for just $49 to start. I don't know how long we're going to be able to keep this going or how long this promotion will last. But if you're seeing this video and you visit this page and it's still available, you know you're good. Because we won't be able to keep this offer on there forever. Well, I'll talk to Kim, but that's what we're doing. So right now you'll have an opportunity to jump on this and check the eligibility for any of the patients that come into your practice, and you'll be able to know if there is money that you're leaving on the table. And again, it's not just 5 or 10%. Sometimes we're seeing 50, 60, 70% of the revenue from the treatment that you should have had and just never collected. So if you want to get the easy biller, you can do so now at dentalismedical.com/EZ. And you can get paid, or you don't pay. And that's the guarantee that I have for you. So for the first 30 people, if this is you, if you're a dentist and you're seeing this video, just for the first 30 people that are watching this, that join dentalismedical.com. And then if you've joined after, it's okay, because we'll be providing some other resources and things available. But just for the first 30 that are joining this new program, we already have a lot of doctors that we're working with, but in this specific program, reach out to me, or as soon as you join, I'm going to get a notification and I'll be reaching out to you because I want to create a group, and you'll have access to me and a few health planners that have been working on this project for the last few years and few months specifically to help you as a dentist get paid fully. So that's the goal, is we want to collaborate dental and medical, but it doesn't matter if we talk about it if we don't put our money where our mouth is. And that's what we're doing for you as a dentist, is we want to make sure that you get paid for the doctor portion of the work that you do, which is the most valuable part of the work that you do. I did have some testimonials or success stories. Like, we have doctors that are working with us, and I didn't prepare them for this because I'm just trying out a new system. But point is if you go on this website, I don't think I have it on there, but just ask, reach out to me, of course, if you're curious. We've done this for plenty of docs. We've actually worked with a state already, and now we're ready to go directly to the patient. So we'll have that in a separate video. Health starts from mouth movement. That's what this stands for. hsfmmvmt is what we're doing. So if you find yourself as a patient, or if you have any patients that you'd like to send to get educated on this kind of stuff, visit our channels at hsfm, stands for Health Starts From Mouth Movement. You can do so there. And then, of course, you're going to find all of the stuff for dentists on dentalismedical.com, because they're just so different, right? So we'll keep all the industry people at Dental is Medical. If you want to learn how to be a better admin for your dental practice, or run the admin part of your practice better, this is exactly the channel that you want to be on. So again, if you liked the content, or if you like the message or any of the stuff in this video, or if you have any comments and feedback for me, let me know. You can like, share, or comment on this video somewhere on this page, and just let me know. Of course, you can also message me as well. On our websites, we do have a way that you can change the language. So in most languages, most of the common ones, we can we can share what we need to share, or you can read what you need to read. So if there's another language that you prefer, and then we also have a chat widget as well. So we're available pretty much at any time. You can see when you pop up at the chat. And so if we're not available right there on the spot, we'll be able to come back and help you. So again, with this Easy Biller program, make sure that if you are a dentist, you don't miss out. This is going to be a chance to get in, and starting at just $49.99 to get started. And it's an incredible deal, because one of these cases as a dentist, and I'll share this in other videos, but just one of these cases could completely, and for some of our other dentists, have completely changed their practice. Because it's not about dental. It's not like that company that we all know that does dental insurance, and it's not like getting paid $260 for a bone graft. It's more like getting paid like $2,900 or $5,300. I don't know why it's so different between a maxilla and a mandible, but that's the fee schedule. You should get paid, for surgery, at least $5,000, $6,000, $7,000, $8,000 whenever you do surgery, because you are a doctor, and there's a proper standard. There's a certain standard of care that you need to meet. If you think about it, the only difference and the reason why dentists aren't getting paid more is because you look at the reason and how nurses or all of the hospitals got paid this much is because they lobbied for it, right? And so that's what we are doing, actually. We're doing that in the background, but I just want to make sure right now to make it accessible. I'm not asking for you to help us lobby or ask us to collaborate dental and medical. If you could just do your part to be the best dentist that you already are, I want to help you fully get paid for the work that you do. And I think you're going to be quite happy with the check. So check out Dental is Medical. We're doing something very incredible here. There's going to be a flat fee for all of the claims that go through this portal. So instead of paying a percentage or a fee that's variable, you're going to pay only, and get this, you're going to pay only for the people that are joining right now. They're starting at just $50. So just $49 for a claim. It doesn't matter if you get paid, $1,000, or it doesn't matter if you get paid $10,000 or $20,000. And we do have those checks that come in all the time. You just pay a very simple flat fee of $49, $25 when you send the claim, and then the other remaining portion when the claim is received. So half when you send it, and then half after you get paid. Just so you know, docs, as far as this works with Medicare, and this works with all the other payers as well, but let's focus on Medicare because that is where most of the demand is. If you do Medicare, the first check will take about 90 days to receive that first check. And then after that, every check usually takes about 10 to 14 days after that. So I hope that answers all the questions for you, and gives you a little bit of insight, and that we all agree that dental is medical, and that you should get paid for the doctor portion of your work. That's what I invite you to do. At least join our channels, or download our cheat sheet if you want, and you can get access to our community and our group. We'll be sharing more stuff like this. But at the end of the day, I hope you have the very best day, and that you do get paid for the doctor portion of the work that you do. We've created the system to be easier than any other system out there. It's streamlined. It's built for dentists. And we just hope that you join and you're able to, take advantage and get paid. So that way you're able to get paid. You're able to reduce, or eliminate any of the compliance issues, and really help the patients and do what you do best. So I'm going to sign off. Thanks. Take care. Health starts from the mouth, and dental is medical.